Hello Zoe, how are you today?
Good, how are you?
I'm good, thanks for asking. My name is Billy Simpkin. I'm a student physical therapist with Tufts University. Is it okay if I work with you on some cranial nerve exams?
Yes.
Okay, awesome. I'm going to be testing 1, 8, then 9, and 10, okay?
Okay.
Alright, so for this first one, cranial nerve 1, that's going to be your kind of sense of smell. So I'm going to hold an object in front of you, and I want you to tell me when you smell it, and then also be thinking, do you smell more through one nostril versus the other, okay?
Okay.
Okay, so go ahead and close your eyes for me. Okay, and then go ahead and just say smell when you can smell the object, okay? And then with one of your hands, go ahead and close one of your nostrils, okay?
I smell it.
Okay, awesome, thank you. Go ahead and switch nostrils. Okay, perfect.
I smell it.
Smell it. Okay, awesome. All right, and go ahead and open your eyes now. Did you tell any difference between the smell in terms of strength?
Not necessarily. My nose is a little plugged, but
Okay.
other than that, no.
Other than that, okay, well, perfect. And then the odor that you smelled, did the odor seem the same or did the odor seem different?
It seemed the same.
It smelled like the same thing? Okay, excellent. All right. So yeah, that's going to be a normal finding. We'd expect a similar strength and, of course, odor detection between both nostrils for that one. All right, so our next cranial nerve is 8, and this is going to be your sense of hearing, okay? So what I'll do is I'm going to make just some light noises in your left or right ear, and then when you hear it, I want you to say left or right, depending on what side you hear it on, okay? All right.
Perfect.
So go ahead and close your eyes and just look forward for me. Perfect, okay?
Left. Left. Right. Right.
Okay. And keep your eyes closed. We'll do one more, and now I want you to be thinking of the intensity, okay? Okay. Any differences in those?
Not at all.
No, say if you felt about the same.
Yes.
Okay, awesome. All right. And we're going to do one more cranial nerve test for this. We're going to be using a tuning fork, okay? Today I got a screwdriver just for demonstration purposes. But basically, I'll activate this tuning fork, and I'll place it at the top and center of your skull. And I just want you to be kind of thinking about what you're hearing. We're expecting to hear equal between both ears or in the center of the skull, okay?
Okay.
So go ahead and close your eyes for me. Hit the tuning fork. Okay. Do you hear the tuning fork? Patient would most likely say yes, and then they would proceed to describe whether or not they heard it more in the left or right ear, but in this demonstration, there's obviously no vibration, so Zoe cannot hear anything. You can go ahead and open your eyes now. So in an abnormal finding, we'd expect that tuning fork vibration to sound louder in the affected ear in conductive loss, okay?
Okay.
All right, put that down. All right, and then our last one we're going to do is cranial nerves 9 and 10. Okay, and 10 is the gag reflex, and we're not going to be testing that today, but we're going to be testing cranial nerve 9. And that's kind of controlling your uvula and soft palate. So what I'll have you do is open your mouth and say, ah, and then I'll look into your mouth and kind of observe your palate and based on where it's deviating, okay?
Okay.
Okay, so let me get a flashlight out, ready? Okay, go ahead and open your mouth for me. Go ahead and stick your tongue out just a little bit. Okay, thank you. Go ahead and say ah. Okay, perfect. And you're good to go. All right, so I did not see your soft palate or uvula deviate to any specific side, which is normal. A abnormal finding with this would be if we saw that uvula and soft palate kind of deviate towards the uninvolved side, okay? And that would be suggestive of a neural issue, okay?
Okay.
All right, well, that's all I have for you today, so thank you very much.